Today we're talking all about circumcision. I get tons and tons of questions about, is it safe to get a circumcision? Why should I get one or should I not get one? And so today we're going to delve deep into exactly the pros and cons about circumcision, and is it really good or is it bad? I'm Dr. Rina Malik, urologist and pelvic surgeon, and if you're new here, I make content on urologic health, bladder health, sexual health, and much, much more. So if you like what you see, make sure you subscribe and share this channel with your friends. Today we're going to break it down. First off, we're going to talk about the reasons to get a circumcision. Then we're going to talk about the benefits and risks of undergoing a circumcision. We're going to talk a lot about the controversies that people talk about, specifically the nerve fibers on the foreskin that's removed. And we're going to answer the question, will a circumcision change your sex life? And lastly, if you decide to get a circumcision, what should you expect? So in this video, we're going to focus specifically on adult circumcision. I'm not going to talk about circumcising infants or babies. This is going to focus on adult circumcision. So reasons that people get circumcised. Well, there's three major reasons. One is any sort of dermatologic condition like lichen sclerosis that can cause changes on the skin that can make it painful or difficult to urinate. It usually looks like scarring or white changes in the tissue. The second reason is balanitis, or inflammation of the foreskin that can sometimes get infected. Often that's due to poor hygiene or difficulty retracting the foreskin and not being able to clean underneath there. And over time, that can lead to some scarring and pain and discomfort. Particularly if you're getting this over and over again, this may be a good reason to consider a circumcision. And lastly, paraphimosis. So paraphimosis is when someone retracts the foreskin on the penis and it gets stuck. And if it gets stuck, then you start having a significant amount of pain because it acts like a ring that's really, really tight on the penis and it stops getting blood flow to the tip of the penis. This then causes the glands of the penis to have a lot of swelling and it becomes more and more difficult to retract that foreskin back over the glands. This is a surgical emergency. If you have this problem, you need to come to the emergency room so that we can try to retract it manually, and if not, then you have to go to the operating room to be able to retract the foreskin. And oftentimes this may require a circumcision. Other reasons that people consider getting a circumcision are for cosmetic reasons and also to reduce the risk of things like human papillomavirus or HIV. In fact, they found that people who've been circumcised have a 60% lower risk of getting HIV or transmitting it to a partner. That's because there's less risk of tearing in the foreskin and less excess foreskin where the virus can get stuck. Also, getting a circumcision can virtually eliminate your risk of penile cancer. So if you don't have a foreskin, it's very unlikely that you will get a penile cancer. So what are the risks that we talk about when we're counseling a patient about a circumcision? We talk about bleeding. Sometimes this can actually result in what's called a hematoma after surgery if the bleeding continues underneath the foreskin, and you can get some bruising and swelling. Usually that will subside over time, and very rarely does it mean that you have to go back to open up the circumcision incision to take care of a bleeding area. Other common complications are people feeling uncomfortable with how much skin was removed or how little, and there's a change in sensitivity. So I've talked about this before in a previous video I made about circumcision, but essentially sensitivity for the very first month or 2 or 3 can sometimes be very, very different because that gland that's usually been covered by foreskin is now wide open. So a lot of times people will become hypersensitive after undergoing a circumcision. The biggest thing I worry about and I counsel my patients on is regret. You have to be 100% sure that this is something you want and be willing to accept the risks. So now let's get down to the question, does it change your sexual function? The best data on how circumcision affects sexual function and sensitivity and ejaculation and orgasm and everything that essentially people are worried about has been done in what's called systematic reviews and meta-analyses. And what these are is they look at a bunch of studies that have looked at all sorts of different components of circumcision. In particular, in the most recent meta-analysis I found, they looked at sensitivity, sensation, pleasure, and function. And they looked at 49 different studies. And specifically, they looked at what's called high to moderate quality studies, meaning that either they're other systematic reviews or they're what we call randomized controlled trials. So it's when people are randomized into 2 groups where one group's get a circumcision and the other one does not. And there's actually been 2 major randomized controlled trials in Kenya and Uganda, which is in adult men. So we can extrapolate this information for men who undergo circumcision as adults. Also, another important part of high quality studies is that there is no or very low risk of bias, meaning that they've tried to look at these groups without allowing other confounding factors or things that might make it more likely or less likely that they're going to have sexual dysfunction. So for example, if you have one group that gets a circumcision but also has high blood pressure and diabetes, and the other group that doesn't get a circumcision but doesn't have high blood pressure and diabetes, you will probably find that in the group that had circumcision with those medical problems, they're more likely to get erectile dysfunction because those comorbidities or those conditions, high blood pressure and diabetes, put you at higher risk of erectile dysfunction. If you want to learn more about that, check out my last video on erectile dysfunction. So when they looked at these 46 studies, specifically at the high to moderate quality studies, what they found was that there was no difference in ejaculation, erection, premature ejaculation, sensation, function, or anything else that would be concerning. So overall, from the high quality data that we have, we can surmise that there should be no difference if you get a circumcision versus if you don't. However, ultimately, if you're the one undergoing the circumcision, you want to know that there are risks of possibly having changes in your sexual function and knowing that this is a possibility. A lot of people say, well, that foreskin that you remove has lots of nerve endings and that can change the amount of pleasure that you derive from having intercourse. And a lot of people state that these specific nerve endings are in what's called the frenulum. When they've looked at anatomic studies and they've studied the nerve endings on the penis overall, they found that there's a specific type of nerve ending that's responsible for erotic sensation. And these are called the genital corpuscles. And these corpuscles are located in the glands of the penis, specifically at the ridge of the glands. So when you feel pulling on the frenulum, it will be highly pleasurable, which makes a lot of men think that the frenulum is actually very important for erogenous sensation. In fact, when you look at the foreskin on the penis itself and you look at the nerve endings in that foreskin, they're actually very similar to the nerve endings anywhere else in your body, which means they respond to light touch, firm touch, pressure, vibration, and temperature, just like anywhere else in your body. So removing a small piece of the foreskin shouldn't have any change on your ability to perceive erotic sensation. But regardless of this data that I've presented, I don't want to minimize anyone who's suffering after getting a circumcision. Certainly there are people who perceive these horrible symptoms after having a circumcision, and I want to be empathetic that this can happen to people. People can have bad outcomes and have regret after undergoing a circumcision. However, it has not been seen in the literature that has been studied about circumcision. So if you decide to get a circumcision, let's talk about what you can expect at the urologist. When you come to the urologist, you'll start with getting the area prepped. So it'll be washed with soap and water, and then they will essentially put a drape on top of you or a sterile draping so that they can keep that area very clean while they're performing the procedure. Then they will use some numbing medication. So you feel 1 or 2 pokes, which will numb the nerves that go to the penis. You may also feel an additional poke around the penis, which will help numb another set of nerves to the penis. And after that, you shouldn't feel anything else. In fact, I've had patients fall asleep during the circumcision procedure because the block is so good. The procedure itself will take about 30 minutes, and afterwards you'll have stitches around the glands that will absorb on their own. So nothing that you have to do or has to be removed. You will have a dressing that goes around the penis that your doctor will tell you to keep on for 1 or 2 days. The thing to know is that after you take down that dressing, it will look extremely swollen and it will not look nice. And that's okay. That's completely normal, and the swelling will go down over the course of the next week or 2. Things that you can do at home is to use ice packs covered in a towel or even just frozen peas on the area to help reduce the swelling. Pain is usually not a huge issue, particularly the day of the procedure. Most urologists will use a long-acting numbing medication that can numb the penis for a period of 6 to 8 hours. After the dressing is off, you can take a shower and let soapy water run down the area. You'll typically want to avoid taking a bath for about 2 to 4 weeks after the procedure. Some urologists may also ask you to put some bacitracin or Vaseline around the incision twice a day. Typically, pain can be handled with over-the-counter pain medications like Tylenol or Motrin or acetaminophen or ibuprofen, and you'll have to avoid masturbating or having sex for 4 to 6 weeks. If you get an erection on your own during this healing period, it's not a problem at all and shouldn't cause any issues with the healing process itself. Also, during the healing process, you'll want to avoid any strenuous activities, heavy lifting, exercising, running, or heavy weightlifting. As far as the appearance or how much foreskin is removed, a lot of people ask me about this. And some people do have preferences, and they will describe this as where exactly they want the cut on the penis, as well as how much foreskin they want removed. And typically, the position of the cut can be described as either high or low. Low meaning that it's close to the glands of the penis, and high meaning it's a little bit further away. Also, the tightness of the foreskin can be determined by how much foreskin is removed. So if it's tighter, that means that more foreskin is removed, and if it's looser, that means less foreskin is removed. Most urologists won't have a specific discussion about this preference with the patients. So if you do have a preference of what it's going to look like afterwards, discuss it with your urologist. However, it's important to understand that if you make that foreskin too tight, it can actually cause pain or discomfort when you get an erection, or make you have difficulty getting erections because the foreskin is too tight. If you make it too loose, then you still may have to retract the foreskin and clean underneath the foreskin. And also during the healing process, if that foreskin is not pulled back from the glands, it can actually get stuck to the glands itself and cause what we call adhesions that need to be fixed at a later date. Most urologists will opt for a just right approach. So we want to remove enough foreskin that you will be able to have full erections and not have any pain, but we don't want it to be so loose that you're going to have issues with healing. All right, well, I hope this answers a lot of your questions about circumcision. If you have more questions, please leave them in the comments below. I'll try to look through them all and answer as many as I can. As always, remember to take care of yourself because you're worth it.